Food is available in the markets, but everything is extremely expensive. We can no longer afford our basic needs. Instead of buying everything we need, we end up buying only a small portion of it. Vegetables are expensive. Fruits are even more expensive. 1 kilogram of fruit costs more than $8, and we simply cannot afford it. People look at the prices and live without buying anything.
Despite more than 6 months of a ceasefire, which Israel regularly violates, conditions remain extremely difficult.
Israel used the ceasefire agreement to calm international public opinion, but on the ground, there is ongoing manipulation of the crossings, a continuation of starvation policies, and restrictions on the types of goods allowed in. The humanitarian protocol calls for the entry of 608 trucks per day. Yet, what actually enters is less than a third of that number.
Human rights organizations have repeatedly accused Israel of weaponizing hunger in the enclave. With the eyes of the world focused elsewhere, Israel is free to act with impunity in Gaza. Millions still face starvation, with many accusing the international community of apathy in the face of ongoing suffering. Ashraf Shannon, TRT World, Gaza.
The World Health Organization says the Hantavirus outbreak on a cruise ship in the Atlantic isn't the start of a COVID-style pandemic. The agency says 5 cases have been confirmed and a further 3 are suspected, but it insists the risk to the public remains low. Daniel Padwick reports.
I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. But this is not the same situation we were in 6 years ago.
Life aboard an infected cruise ship. Turkish YouTuber Ruhi Çenet has now departed the MV Hondius. He captured the moment where the ship captain told passengers the vessel wasn't infectious after the first confirmed death from Hantavirus.
5 passengers sadly passed away last night. I'm told by the doctor were not infectious, so the ship is safe when it comes to that.
He says following the death, passengers weren't isolated and weren't even informed about the virus.
We were together during breakfast, lunch and dinner timings in the dining room all together until my last day, 24th of April. We didn't take any cautions.
But now there's new concerns if the virus could have spread further, especially after the ship's operator and Dutch officials revealed more than 24 passengers left the vessel just 2 weeks after the first passenger died on board. Fear of the virus is now gripping Europe, as cases have been confirmed. This Dutch hospital is treating an infection. It's the same in Zurich, and Germany is also treating someone for possible contact. The EU says it's monitoring the situation.
We follow the situation really very, very closely, and we try to very thoroughly assess every possible risk that would be potentially here for the citizens in Europe.
There's also concern in Asia. 2 Singapore residents are currently isolating, awaiting test results. The WHO says the outbreak should be limited if health measures are implemented.
WHO is aware of reports of other people with symptoms who may have had contact with one of the passengers. It's possible that more cases may be reported. While this is a serious incident, WHO assesses the public health risk as low.
The WHO has also announced it would send 2,500 diagnostic kits from Argentina to 5 countries. It comes as Buenos Aires scrambles to figure out if it was the source of the outbreak. The Health Ministry has reported more than 100 infections since June 2025. The ship will dock in Tenerife on Thursday, where passengers will be tested. Spanish authorities say if they're healthy, they'll be repatriated to their home countries. Daniel Padwick, TRT World.
Well, let's bring in Dr. Bharat Pankhania, who's an independent expert on infectious diseases and joins us live from Bath here in the UK. Dr. Pankhania, thank you very much for your time and for speaking to us here at TRT World. Now, As we heard there, the WHO says that the hantavirus outbreak isn't the start of a COVID-style pandemic. What's your assessment of the risk to the public? How concerned should we be?
This is confined to the cruise liner, and of course we may get more cases, we don't know, and of course we are doing extensive contact tracing of contacts of the passengers who were on the cruise liner. So that is a big global effort going on as we speak. This is definitely not a pandemic virus, and I would like to reassure all our viewers, this is not SARS-CoV-2 Mark II.
But you say that it's confined to the cruise liner, Dr. Pankhania, but health authorities as we speak are racing to trace dozens of people who disembarked this ship. I think it was St. Helena. How much of a concern is that if there are so many potential cases that have already dispersed?
No, it's not potential cases, it's contacts of a case. And what we want to do is identify close contacts of people of interest, i.e. people of interest from that cruise liner. And of course it is a big effort, but by doing so, you capture all those close contacts of those people who were on that cruise liner, and then you give them advice, and then you pull them out of circulation, and in that way you contain something that may have gone on to create more cases. So this is a normal operation. This is what I would expect people to do, and this is what WHO, ECDC, and all the other health authorities concerned are doing.
So would you say that the efforts that are in place to contain this outbreak are effective, or should more be done to contain this? Or is everything being done that, in your opinion, should be done?
In my opinion, everything that should be done is being done. It is never easy because, as you know, people travel through airports, train stations, trains, aeroplanes, and so on. So it is a huge task, but health experts have been mobilized. People will be arriving in Tenerife. People will screen the people coming off that boat and then make sure that when they travel to their home destination, they are traveling in a safe way. It will happen through chartered aeroplanes, care of their respective governments. So there you are. There is an operation that will come into play, and that is the best you can do. And we're very pleased, we're very grateful that the Western nations have the resources to send aeroplanes and to send teams to do all this contact tracing to contain a potential outbreak. That's something to be celebratory of.
Tell us a little bit more about the symptoms, if you will, of hantavirus. What should we be looking out for, particularly those who are travelling?
So indeed, it starts off as something completely innocuous, flu-like symptoms. So you will have a high fever, muscle aches, headache. You may have diarrhea as well. So far, so good. Unfortunately, some people then go on to develop what we call the hantavirus cardiopulmonary syndrome, which is your lungs start filling up with fluids, you become short of breath, and you find it difficult to breathe. That is when you know that there is a lot more involvement. So what happens is this is a hemorrhagic fever, starts off, as I said, with that flu-like symptoms, but it makes your blood vessels leaky. And when your blood vessels are leaky, your lungs start filling up with fluid oozing from those capillaries in your lungs. And then it is that makes you very ill when you're unable to breathe.
You say, Dr. Pankhania, that you believe that this is contained. Meanwhile, for those still stuck on the ship, because let's not forget about them, how worried should those passengers be that they'll catch the virus? because we understand that health officials are stressing that it's human-to-human transmission, which is extremely rare. But how difficult is it to contain a virus in that kind of environment on a cruise ship?
So the ship is doing the best that the ship can do under the circumstances, which is it has already issued instructions that you confine yourselves to yourselves. In other words, don't mingle with people, stay in your cabin, stay away from other passengers. And that is the best you can do. Remember, as far as our science, our knowledge goes, it is close, prolonged, proximal contact with a case. So it is not a case of somebody was 30, 40 meters away and they gave you that infection. It's not like measles, which is highly transmissible. This is close, prolonged contact with somebody who is infectious. And the ship has taken all the precautions that it possibly can whilst it's at the high seas of saying, listen, ideally, stay away from other humans, stay in your cabins.
Dr. Pankania, thank you very much for breaking that all down for us. Really appreciate it.
You're very welcome. Thank you.
Russia has warned all foreigners in Kyiv to evacuate the city, saying it could become a target at any time. It comes after the Kremlin unilaterally declared